I just wanted to talk specifically about the master's program in genetic counseling at Brandeis, but I want to take a little step back first and talk a little bit about, how people, including myself, end up in this career. So I wanted to start with my own career path because I think it actually gives people a good perspective on, how a lot of individuals end up in this field. So I graduated from Colgate University, which is another liberal arts institution with a lovely campus. I'm pretty sure I graduated before any of the participants were born. And here is me and my best friend. We were both bio majors in college, and he knew exactly what he wanted to do. He wanted to go to medical school. And I was not sure I wanted to go to actually, I was sure I did not want to go to medical school. So I thought, okay, I'll go into research. And I was not ready to commit to going into a master's or a PhD program. So I decided to move to Boston and become a research technician at the Brigham. My friend Bill actually went to Columbia and got his MD degree. And while I really loved my 2 years of bench work at the Brigham, and probably the biggest piece of success during that time is that I met my husband, who was also a research technician at the time in a different lab. I realized that there was something that I was looking for in a career that bench work did not give to me. And I was at the time living with another Colgate grad in Boston who said, why don't you think about genetic counseling? And literally gave me a brochure. So this was before the time of the internet or Googling things. So she gave me a brochure about the Sarah Lawrence genetic counseling program, which at the time was one of a few kind of programs in the Northeast. And I applied and I got in and I went there and I got my master's in genetic counseling after 2 years. And I promptly moved back to Boston because that research technician was about to become my husband. And during my time here, I've worked at Boston Children's Hospital in clinical practice. I've worked for Partners Healthcare in both clinical genetic counseling and education. And I landed at Brandeis in 2008 as part of the program's faculty and took over as program director about 3.5 years ago. So genetic counseling as a field, like our program, there are 54 or 55 programs around the country that all train people at the master's level to enter this profession. The profile of genetic counseling as a profession or as a group of individuals is mostly female, mostly white, mostly young, and most people work in their profession full time, and the majority of individuals counsel patients in clinic, although that is actually changing. So when I graduated many years ago, almost all genetic counselors who graduated from a master's program worked in clinical practice. The picture of the US is just meant to illustrate that there are genetic counselors in every state in our country, including Alaska and Hawaii. And I'm really proud to say that one of the 2 genetic counselors in Alaska went to the Brandeis program, and 2 of the genetic counselors in Hawaii also went to our program. But as you can see, there are pretty densely populated areas of the country with genetic counselors, and that's a reflection of pretty top-notch medical institutions and areas where there's also a high population. When you look at what genetic counselors do, as I said, about 70% counsel patients, and of all of those, the majority work in cancer genetics. So they actually see individuals who have a family history of cancer or maybe a known predisposition in their family for people to develop cancer, or they are just worried that they have cancer and are wondering whether there's an underlying genetic pathogenic variant causing it. When I finished graduate school, cancer genetic counseling essentially did not exist because we did not know what we know now. And prenatal genetic counseling, talking to pregnant couples or people planning a family about potential risks, that was the largest area of clinical practice. So that's changed tremendously. And then there are quite a few genetic counselors who do not counsel patients. And in the pie chart, it just shows you where they tend to work. And most of them work in diagnostic testing laboratories or pharma, and then others do different types of research in medical centers. So that just gives you an idea of what people do when they get this degree. And the last piece I'll say about the profession in general is that the demand for genetic counselors has increased tremendously. This graph is now 5 years old, but there are still more positions, which is the purplish line, than there are genetic counseling training slots to fill them when genetic counselors graduate. So this is a great field to join, not only if you like science or in genetics and you want to think about the counseling or the human side of patient care, but the job prospects are pretty good, even during the pandemic. So I'm going to spend the rest of the time talking about our genetic counseling program in normal times, of which these are not. This is where we live on the Brandeis campus. We have beautiful space that is what used to be part of what used to be the science library, and it really creates an incredible opportunity for both faculty and students to have a really nice sense of community. So our program, like others, is 2 years plus the intervening summer. Our class size at Brandeis is 10 students per year, and I'll talk about how we get to that number when I talk about admissions. It is an in-person, without COVID, full-time program, so people don't have the option of taking classes full-time because our curriculum is very scripted and sequenced. So it would be very difficult for someone to complete everything that we have to offer part-time. I have an associate director, Hedel Vig, who works with me, as well as a number of other faculty that either teach or oversee the student research. And of the teaching faculty, 3 of the 4 actually got their genetic counseling degree from Brandeis. So what does the program look like? As I said, it's pretty prescripted. We're actually in the process of looking across other programs at Brandeis to think about electives that we can offer and incorporate into the student learning experience so that they have the opportunity to, kind of take courses that are of interest to them. In the first year, the students start with their kind of core science classes, as well as start to think about genetic counseling as a profession, and also think about and understand the patient stories in the disability awareness and genetic counseling class. So a lot of what we do throughout our curriculum is really get the students to think about and be exposed to and understand what it's like to be on the other side of what the diagnoses that we talk about with patients and families on a regular basis. And then the spring semester includes other kind of core science courses, as well as some more in-depth counseling classes. And then the students do their internships starting in the summer between their first and second year. They also have classes in year 2, although they are fewer because they're doing their fieldwork placements and they're working on their thesis projects. So they have less class time, so they can concentrate on those 2 other important areas of their training. So the curricular strengths for our program, as I see them, are fieldwork rotations. As I said, our students do fieldwork rotations starting in the summer. They do 5 of them, and Brandeis is not on a medical campus, so they utilize sites out in the medical community in Boston, Worcester, Southern New Hampshire, Providence, Rhode Island. And the summer rotation during normal times, they actually have the option of doing that elsewhere. It could be at home, it could be somewhere adventurous like London, where we have an alumni who will always take a student. We've sent students to Santiago, Chile, New Zealand. We frequently send at least one student to Portland, Maine to do their summer rotation. So we have a lot of possibilities for that. Within those 5 rotations, they do one in each of what we call the big 3 or the major practice areas, peds, prenatal, and cancer. They also do a laboratory rotation in a diagnostic testing lab so that they understand how genetic testing works. And that helps them appreciate and counsel patients more effectively about, if we do some type of test on a patient, what they can expect. And then they also have the 5th rotation is a flex rotation that can be actually tailored to the interests of the students. So it could be a specialty clinic, it could be a rotation with a genetic counselor that does research, it could be an advocacy rotation. So that one we can work with the students to identify something that's of real interest to them. All of our students do a master's thesis, and we have an advisor for genetic counseling research that works with them along every step of the way, as well as each student is assigned a PI or research advisor that's on faculty that works with them during all aspects of their thesis. Unlike the projects described by Mariana, for the other students, this is not a benchwork-based research project. It's more focused on either genetic diseases, the patient experiences surrounding them, or the genetic counseling profession. So the 2 that I'm involved in right now are, one is surveying women who have Turner syndrome and their experiences surrounding learning about the infertility associated with their diagnosis and the influence that has on sharing that infertility portion with not only romantic partners, but also individuals in non-romantic relationships. And then the other project is a project looking at men who have Duchenne or Becker muscular dystrophy and their experiences in transition planning. So this is a progressive disorder that allows most men to live into adulthood, but as they get older, they require a lot more kind of assistance in all aspects of their daily lives. So we're trying to understand, what that experience has been like for those individuals. So it just so happens that I actually have 2 that are focused on the patients this year, but sometimes there'll be, genetic counselor focused projects as well. Our students, like the other ones on campus who do a thesis, will be required to deposit it into the university repository, and they also need to submit it for publication or presentation as a stipulation of graduation. And then the other piece that about our program that I think is really amazing is the fact that we focus a lot on disability awareness, everything from disability rights to special education law to understanding what it means to have different types of disabilities, either as an individual or a family, and what it means for them on a daily basis, what it was like going along with that diagnostic journey and coming to that conclusion. So the Brandeis Genetic Counseling Program, as I said, there are 50 programs, which might not seem like a lot, but it actually really is, because I think there were 12 when I went to graduate school. From the perspective of comparison, we are the oldest program in New England. There are currently 4 in Massachusetts, and there is one that's starting up at the University of Connecticut. We were the first one to start in the greater Boston area, so that gives us a lot of experience as well as a lot of connections in the genetics community. We have a ton of alumni that work both locally and all across the country, as is depicted in this map of the US. And I think that that has allowed us to create and maintain a really strong program. Our location is obviously very valuable in the sense that not only can we, capitalize on the incredible medical centers in Boston, but also Worcester at UMass Medical Center. We send students to Providence to do rotations, and we have students do rotations as part of Dartmouth-Hitchcock in Southern New Hampshire. So we actually have quite a few different communities that we can draw on for their fieldwork rotations. And the other piece is I feel like we have a really strong sense of community. I think that comes from being a program with 10 students in each class. It allows us to get to know the students, to mentor them really closely. And the space that we have actually at Brandeis also just facilitates really close interaction between the students and between the students and faculty. So when we look at people who are applying to the program, we obviously look at their academic performance. There's a set of prerequisites that are listed on our website. You do not have to be a biology major, but you have to have taken biology classes, including genetics. We, in the past, have also looked at GRE scores. We made the decision this year because of COVID not to accept GRE scores and not even look at them, because the conversations in our academic community kind of led people to be concerned that, that even though it wouldn't be counted against people, or the perception was, that GREs wouldn't be counted for or against people, the fact that some had them and some did not created an inequity, and we wanted to eliminate that. So we will not be even looking at GREs this year. We also look for additional experiences, and that can come in the form of shadowing or talking to genetic counselors, doing crisis counseling, doing volunteer experience or advocacy with patients and families, and then knowledge of and passion for the genetic counseling profession. So a lot of times people in their personal statement, which is the opportunity to let us know what sets people apart from others, gives people the chance to let us know, how they learned about genetic counseling and, why they think this is a good profession for them, and maybe reflect on some of their experience and how, working on a crisis hotline, for example, might make them a good genetic counselor, or what did they learn during that experience that they're going to take forward when they become a genetic counselor. So our admission cycle is a little bit different than the graduate programs, other graduate programs, master's and PhD programs, both at Brandeis and around the country, largely because all of the programs that train genetic counselors actually participate in a GC admissions match. And that basically means that we all interview and consider applicants. We all submit a rank order list of the people we have interviewed, as do the applicants submit a list of programs that they have interviewed at on a common day, which is this coming year will be April 14th. And then shortly after that, we are matched with applicants that have ranked us highly, and we've ranked highly as well. So that actually allows us to determine exactly how many students we want. So we have currently have 10 slots, and other programs obviously have more or less, but it takes away a lot of the uncertainty that used to exist during what we had was formerly known as an acceptance period, where we would go through, reviewing applications and interviewing people. And then there was a 3-day window where all the programs would send out acceptances, and it was a stressful time for everyone in determining, how things were going to shake out. So this is very cut and dry. The match also allows us to gather really valuable data about applicants, both in our program and across all of the programs. And it's really helpful when we're looking at ways to kind of increase the profession. So our application deadline is December 15th. All of the information is on our website in terms of what we require, but it's fairly similar to what Mariana was saying about in terms of the other programs. The only exception to that being is we do have a set of prerequisite courses that span biology as well as psychology and statistics that people need to have completed in order to be considered. So these are just the resources if you want to find out more about genetic counseling. The National Society of Genetic Counselors, which is our professional organization. Our annual conference starts today. The match service that runs obviously the match. And then our program website, if you want more specific information about our program, I would encourage you to go there. We just updated it and migrated it to the new Brandeis platform. So there's a lot of great information there as well. So I will end and ask if anyone has questions.
Terrific. Thank you, Gretchen. So again, at this point in time, if anybody